As I said right at the beginning on our main talking point today, the dementia drug and the NHS, let's start with David Thomas. Now, David is the head of policy at Alzheimer's Research UK, and you lead on Alzheimer's research and the UK's access to medicines and research innovation policy. Is it possible, as worries me when I reflect upon this matter, that our health system, predominantly the NHS, is out of step with the genius stuff that's coming out of our research laboratories and our pharmaceuticals industry? They're just not matching up.
Hello, Alistair. Yeah, thank you very much for having me on. I do think there is a concern that the NHS is not ready for the sort of medicine that we saw data around earlier this week. This sort of medicine, which is a drug called lecanemab, really relies on early diagnosis. So it's been tested with people in the very early stages of Alzheimer's disease. So that really needs an accurate diagnosis and an early diagnosis. And in the NHS right now, we know that's not happening often enough. There is a backlog of people waiting for diagnosis. That's, in part due to the COVID pandemic, but also people don't routinely have access to the sort of diagnostic tools that you need to provide that accuracy for this sort of medicine.
But David, let me put this to you. You knew that this drug was potentially coming down the track, and also that the National Institute of Clinical Excellence must also have known that it was potentially coming down the track because it's a big trial. Why wasn't the NHS even at that point getting its act together, thinking, will we be ready if this thumbs up from the trial?
I think there's probably a few things. I think, as you highlighted, Alistair, we all know that there are pressures on multiple fronts that are affecting the health service at the moment. So, we're very sensitive, and we recognise that this is not the only forefront that needs to be addressed. I think the other thing is that there has been a long history of failure in this particular area. We've seen a number of drug trials that haven't worked as we would want them to. It's a very high risk place for pharmaceuticals to invest. And with that, that litany of failure, I suppose you can understand why the health systems across the world have been waiting to get that signal that something is on the horizon before they expend energy and money.
But dementia, you know better than I do, but dementia costs the United Kingdom over £300 million a year, and individual families, it can cost anything between £100,000 and £500,000 if it strikes them. There has to be an economic upside to grabbing this and dealing with it, surely.
Absolutely. I think you're absolutely right. I mean, the scale of the challenge is enormous. There are nearly 1 million people living in the UK right now. With an ageing population, that will increase. We think it'll probably be close to 1.6 million by 2050. The numbers are due to treble globally. Of people living with dementia to 150 million people by 2050. So, and obviously the economic impact, that there is an impact on individuals and their families, and that's a really difficult one, but the economic impact is significant. So there is absolutely, we would argue, an economic benefit to medicines that could help relieve that pressure. And I think it's important to recognise is a lot of the costs currently of dementia are not borne by the health service and social care, although there are costs, of course, and big costs. But a big significant chunk of them are actually on the individuals who are needing to leave work to care for loved ones. So there is that factor as well, that societal cost.